Okay, so welcome back, guys, to my YouTube channel. So today's another leisure recommends. So I'm currently at the Sonrisa Dental Office here in Alabang Hills. And what we're going to be doing today is just a different chit chat, a different day because I'll be having a chit chat with Dr. Ayen Alix of Sonrisa Dental Office. So today, so what we'll be covering is anything about oral health. So oral health is something that most people neglected in the past years, and we must admit it. Like when people talk about oral health, they talk about having flu, having colds, getting sickness in their body. But there is one facet in our life that actually most people would miss, which is actually the oral health. So me having a medical background, I am very picky and trusty when it comes to who to trust and who to go to in terms of my oral health. And oral health is one of the many facets that can actually cause diseases and illnesses in our body. And just like way back in school, our teachers would tell us we need to visit the dentist twice in a year. And that's actually very true because we have so many microorganisms in our mouths. And with the right doctor to go, I highly recommend Dr. Ayen Alix. I may, because normally she's out of town or out of the country, so I may go to other doctors, especially for immediate cases, but I keep coming back to Dr. Ayen Alix simply because I know that she's the kind of doctor that she knows, that she actually walk the talk. So she practices what she preaches, and at the same time, we started back in 2003 as a doctor-patient relationship, and it eventually evolved into a closer friendship. She's very dear to me, and I know that I am too with her. So, so there's one thing that you need to know about Dr. Ayen Alix, which we'll be discussing later on because she's been into training. She's been doing some other holistic approach that she planned on incorporating to her dental practice as well. And I'll be touring you as well how Sonrisa Dental Office looks like inside. And then of course, it's gonna be a great day today. So say smile. Okay, so going inside Sonrisa now, and okay, so very high tech. And press the button. Hey Ira, thanks. Oh, so this is how it looks like from the inside. Okay. So this is actually the waiting lounge. So sometimes kasi nagsasabay-sabay yung patient, and sometimes madami talagang patient. So they have waiting area, and of course, this is the inside. Ira, nandito si Docky?
Yes, boss.
Oh, good. Sorry, nag-invade na ako. Hey, Docky! Hello!
Welcome to Sonrisa!
Thank you, Doc. So for today,
Yeah.
what I'm gonna be doing?
Oh, I thought you're gonna go for a consultation today?
Yes, okay.
Alright.
So, yeah, so I have so many things to consult with, and this is what I actually like about Sonrisa. So they care about their patients. So they have sterilizers. This is autoclave. So later di-discuss natin kung ano yung purposes nitong mga to, and how why Sonrisa is investing so much in these materials for the sake of their patients. So, and there you go. So welcome back, guys. So I'm currently with Dr. Ayen, and hi, Doc. So
Hi,
thank you
hi.
for gracing this. So I've been asking you for quite a while on this, and thank you for an opportunity that you spent a day with me today. So
It's my pleasure. Always.
yeah. So why Sonrisa?
Well, honestly, Sonrisa is just, it means smile in Spanish. When we have concept the clinic before, I want to come up with a unique name. I just don't want to be like a plain Alix Dental Clinic. I don't want it, but I wanted something that can have it can be reminded of people because it's kind of different, right?
Yeah.
So I kind of look into the different smile in different languages. So I like the Spanish. So it's literally, it means smile in Spanish.
Oh, that's good.
Yeah.
Going back in the elementary days,
Yeah.
our teacher would tell us like brushing alone is not enough. And I've
Yes.
seen a lot of commercials in the past years that dental offices and some known dental offices would say that brushing is not enough alone. So, bakit nga ba?
Well, it is true. Brushing alone is not enough to keep your teeth healthy because there are things or there are bacteria that merely brushing cannot take out, right? So even like the calcular deposits, it's like when your tartar, they say tartar, already calcified, and that's the hardest thing to remove. So it's not the brushing that can take it out. It's only the regular prophylaxis that you have to do with your dentist.
Prophylaxis meaning to say yung
It's the,
cleaning na?
yeah, it's the routine cleaning of your teeth.
How should one need to go and visit a dentist in a year?
Practically, we suggest we categorize patients. If the patient is like on a regular health, meaning they don't have like a systemic disease or they're not under any maintenance, we usually recommend it every 6 months.
So twice in a year?
Yeah, twice in a year. But if a patient is medically compromised, like they have systemic disease and they are taking maintenance, or they're undergoing some therapies because they're ill, we usually recommend it every 4 months.
Okay.
Yeah. So especially for those patients that are medically compromised with heart ailments, so as to to avoid having what we call the bacterial endocarditis. So they have to really see that their dentist more often because they're more prone to complications
I see.
with dental health. Yes.
And then I've seen a lot of people who are into braces. Is it necessary that people need to go to, and then go for, like, have a brace?
Oh, that's
Kasi
a funny thing, yeah.
Kasi parang everybody's into it na parang, I don't think they need it.
Yeah. Actually, there are more like do-it-yourself
Which is
braces.
scary, right?
Yeah, it is scary because these people doesn't know what's the real percussion of this. It's something that you cannot play with. No, braces alone is a serious treatment for your teeth. But if you just do it for vanity purpose, it's not good because basically orthodontics is secondary is the vanity.
Right.
The first priority for orthodontics is function. Okay, you do it because eventually you want to prolong your teeth and have a good oral function. So that's it basically. Not all patients are candidate. There are patients that doesn't really need it. But of course, with proper diagnosing and proper diagnostic tools, we can basically tell the patient if you need it or not.
Oh yeah, I agree with you.
Yes.
Because nakikita ko na rin sila on some online store na parang, okay.
Yeah.
Parang, I mean, we actually need dental education.
Yes, yes, exactly. These are very, very like in social media. They're very into it, but basically, you have to really take caution on it because it's not something to play with.
Exactly. Yeah.
Yeah.
So scary talaga.
It is.
So with here in Alabang, there are so many dental offices already, dentists.
Yes.
So may mga fake dentists na
Yes.
I tried before, you know that. Pero
Yeah.
what makes Sonrisa up to par with the rest of the competitors pala?
Well, basically, I try not to be too commercial. You know, as much as possible. We cater to the real need of the patient. I guess one of my qualities as a professional it's basically parang I cater personalized treatment for the
Okay.
patient. It's nothing like parang grocery or marketing na one size fits all. It's nothing like that. It's not a free size thing. I do a personalized treatment plan for each patient, and I do take time for each patient. So basically what I'm telling you is I do critical thinking when it comes to treatment planning because not all patients have the same problem.
Yeah.
Not all
Agree.
patients can fit with the same treatment plan. They have to know and be educated of that, and that's how I take care of my patients because I educate them as well. In all cases, like for example with orthodontics, I take time. I do case study and I do case presentation. I do present it with my patient. Oh, this is your case. This is what we're gonna do, and this is our treatment plan, and this is our projected time frame. So that's how I discuss the treatment plan with the patient. I include the patient with the treatment plan.
That's good.
Yes,
Yeah.
and I ask if they're amenable for it or not because basically I have to also work on the profession of the patient, the preference of the patient, and of course on what is their treatment goal. So basically it's more of personalized treatment. I think that's my edge with other dental clinics here.
Oh, yeah. I already felt that. So, but when it comes to people who can just walk, can they just walk in or can I have an appointment?
I would really encourage people to call us for an appointment because as you know, Mac,
Yeah.
I have other activities as well, and not only that, I also usually it's because I do personalized treatment planning. So if I'm not here or if I'm busy, usually I do take time diagnosing patients as well, doing what I need to do to come up with a proper treatment plan for my patients as well. So I really encourage for an appointment. They can do walk in, but I would really recommend calling us or texting us or messaging us in Facebook so that we can basically give them the proper attention.
Yeah, I agree.
Yeah.
No, I've been following you on your social media accounts, and you're pretty much into mission and upgrading your skills.
Yes.
So, what can we expect as a patient from other training and seminars you're attending with? Are you going to incorporate some of the learnings that you're getting, and may mga training ka rin for alternative medicine,
Yes,
diba?
yes,
So,
yes.
can
Yeah.
you tell us more?
Well, I started doing some alternative treatment in my clinic last year. I started that, especially when I started. I enrolled in Smile USA under Dr. Thomas. He's our mentor. Basically, it's more of the orofacial pain management for TMJ patients, like patients with TMJ problems. We call it TMD actually. And with patients with difficulty in sleep, basically. So I already started adopting that, and then slowly gearing on a little bit of holistic treatment type. But because nowadays, as we see, not all are answered by prescription drugs.
Yeah.
Okay, some you can incorporate physical therapy. You can incorporate sleep hygiene.
Oh, meron din
Yes,
ganun?
yeah.
Oh.
I do teach sleep hygiene on how to really get that proper sleep. It's not that you just sleep. No, you have to have that good sleep that you feel refreshed in the morning after we wake up. Yeah, and then also, of course, adapting the theory of proper occlusion when it comes to treatment planning with my orthodontic patients as well. So, what I'm telling you is, not all dentists are like this. Yeah, because
You're actually extraordinary, to be honest. So.
There's just a few of us in the Philippines who studied that course, no. So it's like an eye opener for us. It opened our eyes that somehow, instead of giving the proper cure for our patients or proper treatment, we've add on something that's getting them worse. So if we don't do the proper diagnosing, if we don't see the patient's history, especially with medical history, we tend to neglect some of the important key points in their treatment. That's why even if like you had a good orthodontic treatment plan or TMD treatment plan, you always fail. Because there are some instances that you don't consider and you don't really know about it. So that's why I've already encountered some patients like that since last year, and then slowly I'm trying to treat them and help them because they've been to some clinics that have already made some, I don't want to say damage, but they have experienced some treatments that are not necessary for them.
Yeah, it happened to me before, so I think a fair share of experience as well.
Yes.
So I actually noticed, Doc, you have so many investments in terms of tools.
Yes.
So the autoclave, you have the sterilizer. So I think this is something that sets you apart with other dentists, because I've roamed around with some of the dentists in the past years and I haven't seen such technology that you have.
Well, I'm very, very OC when
I
it
know
comes
that.
when it comes to sterilization. As you know, in our country, we've already topped the grossing. We're the top grossing country when it comes to HIV.
Yeah.
Okay.
Yeah.
So you would never really know who has HIV.
Yeah, true.
Alright? So you just have to be very, very careful in sterilization because you can cause cross-contamination.
Right.
Diba? So when it comes to sterilization, I spend money on that. I spend I don't want to say half of our income in the clinic, but I would rather a good amount on it because I would rather be on a health side rather than on a risky side, right?
Yeah.
So we do like a cold sterilization first when it comes to chemicals, we do the chemical sterilization, and then after the chemical I do the autoclave. And then storing those instruments, we do the heat sterilization. So basically, it's a three thing. And then every after patients, normally we change, like in our scalers, we have like we call it like a sleeves on them, and then we throw it out after each patient. Even on our scalers, in our handpiece, our tubings, they are all, they have all the sleeves.
Yeah. Even the mask, the gloves. Yung
Mask,
kasi encountered
the
before,
gloves.
di ba yung kinukwento ko sa'yo many years ago,
Yes.
yung doctor, although he's already dead, so, yung gloves niya, hindi niya ni-change per patient. So, okay, di ba?
Yeah.
Oh my God.
So, of course, I change. I use a nitrile gloves because latex has powder. Although there's a powder-free latex already, but latex tends to have more allergy reaction to some patients. So that's why I use nitrile gloves already. We use like disposable bibs. If we have like surgery, we do drapings. If we do like for example, of course, we do face mask. Do the proper protocol for sterilization and health hazard, we do it here. And I even use distilled water on my water system. Yeah.
That's one thing I love about Sonrisa. So this is my last question, Docky. Apart from being a dentist and undergoing some trainings, coaching seminars, what other activities you're into? What makes you busy outside dental world?
Well, before I used to do triathlons. I kind of had a very fun moment with triathlons. But nowadays, since I'm protecting my skin, so my husband doesn't want me to do any triathlons anymore. So I'm doing like running, but I would like to go back in swimming again. Because that's the only thing that maybe I can still hang on to, which is aquathlon. The only race that I could join. I'm supposed to do a marathon this Feb. Actually, it's on Sunday. But since it was relocated in Clark due to the Taal eruption, right? I have to defer because it's not in my game plan, right? So I defer for next year. And I'm thinking of joining some marathon races, but siguro maybe mga half marathon lang, 21 kilometers maybe, that's it. But basically, it's more of that, and also, syempre, being a housewife and a mom. That's it. So, syempre, I have also my family obligations.
So, so I want to thank you, Doc, for this opportunity. So it's an honor to be with you today. And would you like to invite the viewers, the subscribers, to visit you? Where are you located, and what social accounts that we can follow you actually?
Okay. Hi guys. So you can visit us here in Alabang Hills. We're located at Alabang City Arcade Building. We're just above PPI in the West Service Road. You can follow me on my Instagram account, Sonrisa Dental Clinic, and also it's the same name for our Facebook account.
All right. So thank you once again, and don't forget to click like and subscribe. Thank you so much.
Thank you, Mac.